Hello, I would like to take a few moments to discuss with you a problem which many of you ladies experience, and that's urinary incontinence. Urinary incontinence is the involuntary loss of urine or loss of bladder control. The symptoms may vary from extenuating problems to maybe none at all, except the loss of the urine. You may notice a heaviness or pressure or a bulge in the vagina. Loss of urine with laughing, coughing, sneezing. These are all associated with stress urinary incontinence. Many of you have seen the ad on TV with the gotta go right now. These are bladder spasms. These are problems that give you a sudden urge to void, but you don't quite get to the bathroom on time. Sometimes you may have a filling of the bladder or an overfilling of the bladder. You notice that you void frequently, but then you have to go again, and then you lose urine when your bladder gets full. There is a sphincter in the bladder, which sometimes, when it doesn't function properly, will cause leakage of the urine because it doesn't close down completely and will allow urine to leak out. Sometimes you will notice problems with certain medications that you take, such as diuretics, which cause filling of the bladder on a rapid basis for some of you ladies. These are just some of the symptoms that you may experience. Well, how do we diagnose exactly which problem is yours? Very often you have more than one problem. There is a test called urodynamics in which the functions of the bladder are evaluated. These include the capacity or volume of the bladder, how much will your bladder hold. It evaluates the little muscle that surrounds the bladder to see if there's spasms. It also looks at the function of the sphincter inside the bladder, and it also checks the pressures. When this is all evaluated, this will give your doctor a better understanding of how your bladder functions, what the problems are, and what may need to be done to control your problem. So how do we control the problem? Well, in some of these cases, it requires surgery to rebuild the support under the bladder and to correct the bladder angle. In other cases, medication is needed to control the bladder spasms. With those who have overflow incontinence, you may need to do bladder training exercises and in some cases, catheterization. Now, it's important to understand that when you're treating urinary incontinence, all problems need to be treated simultaneously. Just treating one problem and not treating another will still leave you with urinary incontinence. If any of you have these problems with bladder control, please feel free to contact your doctor, discuss the diagnosis and the management that may be used to alleviate your difficulty.